Welcome back, everybody. This is Dr. Stokes with Bread and Butter Primary Care, and this video for today is anxiety. What is it and why do we care? So we talked a little bit already about depression and why it's important and what it is, and so we're going to talk about its, in some ways, sister diagnosis, anxiety. So first, let's define anxiety. And that's different than generalized anxiety disorder. And so we'll kind of make a distinction between those two, where the general anxiety disorder is mostly what we're diagnosing and treating, and then anxiety is kind of a component of that. So the best way I like to think about anxiety is the physiological, and that includes mental processing as well as changes in the body's physiology that happens when we're under moments or events of stress. And so I like to use the example oftentimes of walking through the woods and coming across a bear. And so you're walking in the woods and you come across a bear, what happens? Immediately you're going to start worrying about your safety. What's going to happen? Is this bear dangerous? And what should I do? And so there's a worrying component that kicks in. Physiologically, you have dilation of the pupils, getting ready for distant vision in case you have to run. Blood is going to leave the gut and the viscera and it's going to go to the muscles, so you're ready to either fight or run. You'll get sweaty, because the temperature increased because of all the blood going to your musculature, and those types of things. And so you have this physiological response where you're going to have a racing heart, an increased respiration rate, sweating in your hands, tight muscles, and worrying and that sensation of fear. And those things are all useful if you're walking in the woods and you come across a bear, because you need to get ready to get yourself safe. So that's anxiety. That's an anxiety response. It's an appropriate anxiety response. And so in one way to think about generalized anxiety disorder or anxiety in terms of a pathology is when your body goes through that response even though there's not a bear. And so it's a normal response if there's a bear. And now a bear can be symbolic of a lot of things. A test, having to drive to the store, having to do what usually would be very simple things in some people can elicit that same physiological response as you would expect when you come across a bear. And that's when you start getting more into the disorder of anxiety, is an exaggerated response based on a stimulus that's not actually as dangerous as the response would be worth having. And so I like to think of anxiety as a normal physiological response to prepare you for danger, and anxiety disorder is experiencing those feelings and that fast heart rate and all those things even though the danger's not there. So generalized anxiety disorder is defined, as far as like in DSM criteria, as excessive worrying most days for 6 months or more. If it's less than 6 months, then it can still obviously be an anxiety response. There's adjustment disorder and things like that, grief reactions, and we can talk about some of those things in other videos. But generalized anxiety disorder, GAD, G-A-D, is excessive worrying that interferes with your life for more than 6 months. So that's the easiest way, as far as bread and butter, to think about it. I think there's actually 5 or 6 different things in the DSM that you can meet, but generally they're all in that same general grouping. Again, you have that excessive worrying most days for more than 6 months, and it has to be bad enough that it interferes with your life. It can't be caused by something else, some other diagnosis or some other problem. And so if you have those things, then technically you would qualify for generalized anxiety disorder. Why is it important? A lot of it is because of lost productivity and decreased quality of life. And so you can imagine if going to the store or going to a party or going to visit family or getting out of bed in the morning elicited the same response in your body as coming across a bear in the woods. It changes the way people live. It changes what they're able to do, what they're able to experience, the people they're able to meet, if they're able to work. So lost wages and disability is a huge part of anxiety disorder as well. And as we talked about a little bit when we did the What is Depression and Why Do We Care video, we're finding more and more, just as with depression, that there's a very biological, physiological basis for generalized anxiety disorder. And so the brain chemistry part of this diagnosis also exists. So anxiety, like we said, can be provoked because of situations, social situations, dangerous situations, things that usually would provoke a fear response. But the way that that response happens is brain chemistry. And so differing levels of things like serotonin and norepinephrine is what causes the sensation that we know as anxiety. And so you can imagine if someone's brain is in a small degree malfunctioning as far as the number of those hormones released and for what reasons, then you can have the situation where you're having this full out anxiety response for things that don't really cause anxiety. In a way, it's almost similar to allergies. You know, pollen is not dangerous to a person's health, but for some reason, some people's bodies think it is, and they get a little pollen in their nose, and their body freaks out like it's some sort of horrible virus that's going to destroy them, and so they get this inflammation and this mucus running, and they have an allergic response. And it's a physiological, an over-exaggerated physiological response. And no one tends to say, well, people with allergies should just learn to get over it and should just like learn that pollen's not dangerous. Some of that is simply the fact that the physiology is responding in an exaggerated way. And you could say that it's not the patient's fault that that happens. Now, certainly anxiety, there are huge amounts of social factors. Just like with depression, you have both of those, the social factors and the physiological factors, and you need to address both as far as managing and dealing with people with anxiety. And I think it's helpful for providers, especially to have that insight that this isn't entirely something that is within the control of the patient. It's not their fault per se that they have a hyper physiological anxiety response to otherwise benign stimuli. And so I think that's an important way to think about and look at it as well. So that's what anxiety is, an exaggerated physiological response that happens to not actually dangerous, I guess you could say, stimuli. And it's caused both from social factors, history of trauma, history of issues and behavioral type of things, and it's also caused by brain chemistry and hormones and neurochemistry. And so approaching it that way really helps you to, as we approach treatment, as we will in future videos, as far as how to help people who are suffering with this. And so and then why it's important is, because of people's quality of life, both in quantifiable terms as far as lost wages and ability to work and ability to produce things for themselves and their families, as well as more subjective terms, satisfaction with life, ability to do all the things that they would like to do without having this constant anxiety response going on. Another thing to consider, I didn't mention before, is that there are actually studies that have shown that people who have this exaggerated anxiety response do tend to suffer more from heart disease and things in the future because their system's in overdrive so much and things just get worn out quicker. So there is that comorbidity as well that comes along with it. So that's what anxiety is. That's why we care. I hope that's helpful, and you guys have a great night.